In a clinical setting, few topics create a thicker wall of silence than sexuality. When the conversation turns to intimacy, therapists often face dead air, as the deeply ingrained taboo around sex makes it difficult for patients to articulate their needs. To bridge that gap, there is a specific visual tool, the Let's Talk About Sex Therapeutic Cards. They are designed to bypass that initial hesitation and provide a safe, accessible way to start the conversation. The tool was developed by Ronnie Burke, a clinical social worker and certified sex therapist. After years of watching patients struggle to find the right words in therapy, Burke created these decks to turn abstract anxieties into concrete images. Alongside the primary deck, there is also the Free to Be Me set, tailored specifically to explore self-expression and identity within the LGBTQ+ community. Over the next few minutes, we will walk through a structured, 4-step method to implement these cards in your practice, allowing you to move past the clinical taboo and help your patients safely explore their sexual identities. Step 1 focuses on the intake. The initial assessment is usually when defenses are highest, making it the ideal time to introduce a visual medium. You start by spreading the deck across the table. Simply ask the patient to look through the images and choose a single card that speaks to them. Because the artwork is evocative rather than literal, the patient isn't forced to talk about themselves directly. Instead, they project their internal world and hidden concerns onto the painted character. Once they select a card, you guide the interaction using specific, open-ended questions. You can ask, "What do you see in this picture?" Or, "What is the story of this character?" From there, you gently bridge the gap to their own experience by asking, "Do you feel this way sometimes?" By framing the dialogue around the illustration, you bypass biological defenses. It creates a safe, third-person buffer zone, making it possible to discuss highly personal feelings right from day one. Step 2 moves into a more structured exploration called the 3-card exercise, designed to map out sexual identity and boundaries. This exercise relies on clear clinical parameters. You are asking the patient to define their comfort zones by identifying feelings of connection, hesitation, and outright rejection. First, prompt the patient to choose a card that represents a strong connection, an image that elicits the feeling of "this is me," representing an experience or emotion they closely identify with. Second, ask them to find a card that causes hesitation, conflict, or curiosity. This highlights an area of confusion or a desire they might be unsure how to articulate. Finally, ask for a card that firmly represents, "This is definitely not me." This safely establishes their hard limits and shows you exactly what they wish to keep outside their world. This triad of choices provides a functional blueprint of the patient's sexual comfort zones. They establish their boundaries clearly without having to summon the vocabulary to build those boundaries from scratch. Step 3 applies these tools directly to couples therapy, where verbal communication regarding intimacy has frequently broken down entirely. The core instruction here requires each partner to browse the deck and choose a card that represents their current sexual feelings, specifically within the context of the relationship. You guide them with targeted prompts. For example, ask them to locate a card that signals something they feel is missing, or an intimacy they deeply desire from their partner. Next, ask them to find an image that represents their exact communication barrier. What makes talking to each other so difficult or blocked? This visual exchange often breaks the deadlock. Instead of retreating into rehearsed arguments, partners are forced to literally see the other person's perspective through an image, naturally generating empathy. Step 4 involves advanced creative techniques, like the blank card, while establishing necessary clinical guardrails. If a patient feels their specific experience isn't represented in the deck, you introduce the blank card technique. Ask them what they would draw or write on an empty card to capture their unique narrative. As you use these exercises, you must remember the primary safety warning. These cards are emotional triggers designed to spark dialogue. They are not objective clinical diagnostic tools. Therefore, you must operate strictly at the patient's pace. The framework relies entirely on open questions, applying zero pressure, and maintaining an environment completely free of judgment. The true utility of the deck is its exploratory nature. When you remove the pressure to perform or explain, the patient is empowered to lead their own discovery process. By working through these steps, you now possess a structured framework for integrating sexual communication into your daily practice. You have a method that uses an indirect visual medium to access complex emotional worlds without triggering the patient's immediate verbal defenses. To implement this in your own clinic, you can order the Let's Talk About Sex and Free to Be Me card sets online at ronburke.com. With a simple deck of images, you can turn the thickest clinical silence into an open, constructive conversation.